So it's nice to be here today and to talk a little bit about this project that we did. And this was a project, as Laura mentioned, that we did with the Building Strong Foundations for Families Coalition team. And the initial idea that we had for this project was getting kind of deeper into talking to parents about their experiences with infant and early childhood mental health services in the state. And we backed off from that for a few reasons. We didn't really have enough time to do it within the Building Strong Foundations for Families timeline, but we also identified in some of those preliminary discussions with that team, just some questions about like, what is this infant and early childhood mental health system in Minnesota? What does it include? What does it not include? How is it organized? And how are people experiencing that? So we did a project instead where we interviewed 19 people across the state who have some experience and expertise related to infant and early childhood mental health. And this comes from a variety of sectors. We talked to some state and county government staff. We talked to advocates, early childhood educators, some mental health professionals, pediatricians, and others. And so these were really kind of in-depth qualitative interviews about how people defined the system, how people perceived equity within the system, recommendations for strengthening the system, et cetera. So I'm going to go through just what those findings were from this series of in-depth interviews that we conducted in the fall. These are the four basic categories of information that we addressed in the interviews. So what is the structure of the infant and early childhood mental health system? What does equity look like within that? What are the pathways to accessing services? So if you are a parent and you're concerned about a child, how are you getting connected with that set of services and supports? And then what are the recommended strategies to increase awareness and improve access? So the first set of findings that I want to talk about is how people defined the system. And throughout this presentation, I have a lot of slides with quotes, and we're going to go through some of them pretty quickly, but all of those quotes are also in the materials that were attached to the agenda today. You have two documents. You have a full version of the report plus a briefer executive summary. So one thing that came up when we asked people, what does it mean to have an infant and early childhood mental health system and what is included in that system? One of the things that jumped out right away is that people were talking very broadly about this entire continuum of care: prevention, early intervention, deeper intervention, community level supports, and that a strong recommendation from the beginning that we're thinking really holistically about where kids are and what does it take to support their well-being. And while people didn't quite use the words, it aligns really well with other frameworks around public health and mental health, where we're really thinking about kind of these tiers of supports that if we're really focused on well-being, we want to be thinking about universal supports that are just pretty much widely available to everybody, targeted supports where we're giving some specialized services to people who need it, and then this more intensive individualized supports where we're giving more rigorous and tailored mental health services specifically to young children and their families. So that's kind of the framework that we then brought forward in thinking about the findings is that if we're really wanting to support infant and early childhood mental health, we want to be thinking fairly holistically about kids and what they need at these different levels. As Laura mentioned, Catherine Wright is here. She represents the Department of Human Services and is behind a lot of this work that is coming out of DHS. And we wanted to sort of show where this fits in this kind of model that our interviewees were talking about, and she can talk a little bit more deeply about these interventions. But essentially, the Department of Human Services has been for some time now promoting capacity building for infant and early childhood mental health with a few very targeted evidence-based practices. And this includes things like a diagnostic classification system that is tailored. It's really specialized for young children. We can't just take things that we do with older kids and use them for younger kids. So, these are all very specialized services. So how do we do a diagnostic assessment for young kids? There's a few different therapeutic models that they're doing, and you'll see if you read these descriptions, when we're talking about infants and young children, again, therapeutic models that we use for older kids don't work. Like, we're not going to do traditional talk therapy with an infant or a toddler. So there are a number of really well-established evidence-based practices for working with young children, and they're typically these dyadic models where parents and their children are participating together. And so there's a few of them that have really strong evidence, and DHS has been promoting that capacity. Not on this list, but we'll talk about it a little later in the presentation. There's also some services and supports coming through DHS that are focused on things like childcare consultation, where we're working with childcare providers to help them support youth and help that or young children, and helping them address mental health issues in early childhood settings. And so the array of services coming through DHS is a little broader than this, but these are some of the main things that people are doing kind of through that network and through that system as it relates to infant and early childhood mental health. And people talked a little bit about that, and it didn't come up in all of the interviews because I think people really were thinking a lot about this early intervention and prevention. But there was, I think, this consensus that those are pretty good things. There was some concern about that being narrow enough to sometimes be difficult for people to feel like they could access it. But in general, I think consensus that those are good services. I think the main concern that people had about it was when you're really building that capacity to do these very well established evidence-based programs, it takes some time to build that capacity. Those are not easy to roll out in a general way. You need a lot of training to do those interventions and those services. And so there was some concern that came out about they're just still not being quite enough, not as much as people would like, and hard to access some of those services, especially when we start to get out to the metro area or out of the metro area. And so people talked about just feeling like there weren't always enough providers, that it was sometimes there's a long drive to get to them, sometimes there's long wait lists. So that comes up as a challenge and issue. And again, this isn't that DHS isn't trying to get them out into those areas as much as it's about it takes a long time to get that capacity up, and people felt like it's not quite there yet in terms of meeting those needs. And then just some quotes that came up in those interviews. So if we go back to this framework, DHS is really doing a lot of those individualized services and supports. The evidence-based practices that they are providing that training and support for are going to be those things at the top of the triangle for kids who really need an intervention, for families that really need some support. Those would not be services that we're talking about embedding, as a preventative strategy or as a universal strategy. They're kind of at that top level of the triangle, which is fine. Like, we need people to be doing that work at the top part of the triangle. A lot of the rest of the presentation is about the bottom half of the triangle. And I think the people that we talked to through this project were really focused on what else do we do to support kids in the settings where they are, to promote positive parenting, positive child development, supporting kids in other ways. And the idea with these frameworks is that, the more we're doing work at the bottom of the triangle, the less we need the top of the triangle. There will always be some kids who need that more individualized more intensive intervention. But a lot of the people that we talked to were more focused on, what do we do at that more universal or targeted level? So that's kind of the primary focus of the rest of the content and recommendations. When we asked people to define infant and early childhood mental health and what that system is, these are the things that come up the most often. People talked about those mental health services, but they were actually a lot more likely to talk about things like early childhood education and childcare, healthcare system, including things like pediatric care, well child visits, things like that. Schools, which people talked about a little differently from childcare, although there's some overlap there in terms of early childhood education, but people talked specifically about some of the early intervention supports, for example, that are coming through schools, some of the screening work that's coming through schools. And then the other one that comes up a lot is home visiting and other public health programs where they are working with families with young children. And these 4 systems came up over and over again as really important places where we need to be thinking about infant and early childhood mental health. And the commonality here is that many of families have those connections to these systems. Not all, but many children are already receiving services and supports through these systems. And the more we are embedding that focus on mental health and well-being in those settings, the more we're able to improve that reach and make sure that we're supporting kids more broadly. The second thing that we addressed in the interviews was equity and asking people, what does equity look like? It was more visionary. It was not so much a commentary necessarily about what we're doing now, although that certainly is part of it. But what does equity look like when we talk about infant and early childhood mental health? How do we know if we have a system that is equitable? And there's a few themes, again, that came up repeatedly in the interviews. One was that for a system to be equitable, everybody has to get their individualized needs met. That is not one size fits all. Families are going to come in with very, very different needs depending on what specifically is going on with their kid or with their family. It will vary depending on cultural background, on socioeconomic status, on where they are geographically in the state. So people talked a lot about that equity means that everybody gets what they need when they need it. And that array of services is really tailored towards and sensitive to those individual needs. The second thing that comes up a lot is that diversity of the workforce. That for a system to be truly equitable, many of our interviewees talked about the importance of having a workforce that reflects the populations that they're serving. People did also talk again about some challenges of achieving this, especially in some of the more rural communities. But this came up pretty frequently in terms of wanting kids to be able to have access to service providers that know their communities, that reflect their communities. The third definition that comes up a lot related to equity in these interviews is that all of the resources that we provide should be culturally adapted and translated. And people were generally talking here more about written materials, informational resources, newsletters, anything that is family facing is what they were talking about here. And there's 2 ideas that are coming in here, and they're both important. One is translation, and there was a general consensus that translation is important. That people felt like the field thinks it's important, but that we don't always have capacity to do it. And then there's this other layer around services, around materials being culturally adapted, which is more than just putting it into other languages, but really making sure that the content resonates. And this was everything from people talking about colors and imagery that they were using, but also thinking about values and kind of what that cultural context was, and making sure that we are thoughtful about what is going out and who is going to, and is it going to be culturally relevant and accessible. And then the fourth thing that comes up in those definitions of equity is that providers and systems need to continue to address racism and bias. And the reference here to providers and systems is very intentional. People talked, for example, about individual providers needing to continue to do work, through reflective supervision or through other types of efforts to be mindful about the bias that they may be inadvertently carrying into settings, how that may be impacting the way that they work with families, and that there is no substitute for people doing that work. But people also talked about some systemic level issues. A few people talked about just a general lack of diversity isn't quite the right phrasing, but the field of people working in the early childhood setting is not as diverse perhaps as it could be. There was several people who made reference to this idea of, we're all well-intentioned, we all care about kids, but we're not that diverse. And we have inadvertently built in policies or systems that create disparities or lead to bias, and that we need to be very mindful of when we are creating systemic level strategies or policies to make sure that we are addressing that, and being thoughtful about other perspectives so that we don't institutionalize and kind of create these frameworks that we know over time perpetuate bias. The third area that we focused on in the interviews is how people get connected with services and supports. And we started by asking, how do parents get connected? And what people generally said is that the way that parents are getting connected tends to be through those same systems that I mentioned earlier. Parents have a tendency to start with the people that they know, to start with the systems that they know. And so if you have a concern about how your young child is doing, you might ask your pediatrician, you might ask a child care provider, you might ask your home visitor if you have one. And that those agencies tend to be that front line of support and connection for parents. What's interesting, I think, or one of the things that's interesting about this question is that while people often emphasized these systems, some other systems start to come in here that people didn't really identify when we asked them to define the system. So child protection, for example, came up a lot here as an entry point into early childhood mental health. Nobody that I interviewed identified child protection as a critical part of the system, but now when we were starting to talk about how do we get to the system, child protection came up a lot in those interviews. And in a way that I think shows some of those different pathways into the system. So several people talked about families of color, families in poverty, families who are struggling in some way, that their primary access tended to be through child protection, while other people were not. This may or may not be borne out in the data, but it was a very strong, I think, response from the people that we interviewed, that child protection was a critical pathway for many families to get connected to services and supports, not necessarily as the provider of those supports, but identifying that something would be helpful in trying to make those connections. The other thing that comes up a lot here is the importance of screenings and having universal screenings, developmental screenings that are being done through schools or in other settings. People talked a lot here about Help Me Grow and access to that system as being really important ways that parents are getting connected to services and supports. So people, that came up pretty frequently in terms of the importance of having places where people are getting screened and having these accessible systems where people can find out what's available, get connected, and get resources. There was a lot of discussion in these interviews about kind of the strength of the role of these systems, the childcare and home visiting and the healthcare system, and that those provide a really important place where parents maybe already have trust, they already have relationships. The more we are building on those trust and relationships, that it's a great way for parents to have a safe person that they know that they can talk to and get connected. On the other side, though, we know that not all families are equally connected to those systems. They may have chosen not to participate in some of those systems. They may not have access to some of those systems. They may have a lack of trust in some of those systems. And so if we're going to rely on those systems to be that entry point or that pathway to getting connected with care, we need to know that it's not universally reaching all kids and families. It's reaching a lot of them, but we definitely have groups that are less connected and who are not going to not have that same access. When parents are not getting access through services and supports, they're having to do this research on their own. And I think almost everybody I talked about this in some way, that if you are a parent and you are worried about how your kid is doing, you might go on the internet, you're looking online, you're talking to people that you know. There's a lot of research that parents have to do to try to figure out how to get connected. And this is borne out in some other research that we're doing as well. Like this is not unique to infant and early childhood mental health. This is pretty pervasive, I think, in children's mental health in general, that parents have to do a lot of research to find out what's available and how to get to it. And again, that's another place where we're going to start to see some of that disparity, that if you are a parent who has resources to put into this in terms of time to do a lot of online research, time to be making a lot of calls to providers. If you do not have language barriers that make that difficult for you to connect to those systems, you know, some parents are going to have this easier time doing that than others. So it's just another place where people were very mindful of the strategies that we use to get to early childhood mental health are not necessarily equally available. And then we also asked about providers. Since so many kids and families are connecting through places like their childcare providers or their pediatricians or their home visitors, it raises the question of what do they know about the infant and early childhood mental health system, and how prepared are they and how comfortable are they being that point of connection? How did they learn what's available about infant and early childhood mental health? And there's a few key themes that come out there. One was kind of this question of what training they receive. And that is part of the training, like the college education or the professional training. Infant and early childhood mental health may not have been a big topic in their training. So they may not know that much about infant and early childhood mental health just on the basis of having been trained in their discipline. It may or may not have come up. And people talked about some challenges that they have learning about these systems. So siloed service systems, people talked about that if you are working in healthcare, for example, if you're a pediatrician or a doctor, and a parent expressed concern, you started by looking at what else is available in our healthcare system. You know, you start with the system, you know. And so your knowledge of what's available through that system might be high, but you might not know what's available from other community agencies or what's being offered through the school district, for example. Like these systems tend to be pretty segregated. And so you know your own better than you know this full array. People also talked about the fact that that services and sports seemed to change quickly, and that they felt like they learned it, and then it was all different. Different providers were available. People, programs came and went, and it's hard to keep up. So that came up a lot, and just the lack of kind of this consistent access to training, and feeling like training is out there, but it's not necessarily consistently offered. You have to find it, you go out and get it, and it's there, but it's not built into your system consistently. And those are just a few of the quotes that reflect those themes. And so people did identify some services and supports that were helpful in learning about this, but again, they're not universally available. So this is where childcare consultation came up a lot, that people said, if when I had access, or, when I brought in somebody to consult with me at the childcare setting, it was really helpful, because they not only helped me understand what was happening in this, with this child, or things that I could do to support them in the childcare setting, but they also knew a lot about other services and supports, and they helped make some of those connections. And then people talked about agency outreach, that the way they learned about other services is that they went out and visited programs, or that other programs came and visited them. And there was a lot of emphasis on, people needing to do that footwork to go out and meet each other. And that some agencies had a very intentional strategy to do that, and some did not. Resource directories. This one I thought was really interesting, because in many ways it was a fairly kind of old school strategy that people talked about. Multiple people said, oh, we put together a list every year, and it's laminated and it's on my desk and I use it, and it's the most helpful thing that I have. But of course, we also know those are not necessarily systemic. Those are also hard to maintain and update. But people felt like when I have a list of what's available, it was very helpful. And then people talked about local collaborations, which were sometimes organized around mental health. Sometimes they were organized around early childhood. But when they had a team of people coming together that they could meet, then that was really helpful in helping them learn what's available. And again, similar to parents, most providers had to do their own research. People talked pretty frequently about, as a pediatrician, as a childcare worker, as a mental health worker, I have to go out and make an effort to learn what is available outside of my own bubble. I researched online. I went out and tried to meet people. I really had to do that work to find out how to connect kids and families. And so then finally, that's kind of the state of the system right now through the eyes of these 19 early childhood representatives across the state. So then we also said, well, how do we improve access and awareness? What are some things that we can do to make this easier for families to access what they need? And people talked about some different levels of services and supports. People talked about things that are more parent facing that are helpful, more informational resources, navigation support, having people embedded in some of these systems, like through your medical clinic, for example, who can work with you more directly to figure out what you need and help you make those connections. People also talked about general parenting supports, parent education, parent-focused services as being important as well. That, if we're connecting to parents, then we have that inroad to supporting kids. With providers, again, people, we have services that are coming out that are really helpful. There were quite a few requests to just we just still want more. We want more people, more diversity within those people, and making it a little easier for people to get that, to get and maintain that certification. That people still, even though it's being supported right now, people talked about just the investment that it takes to do that, and that it's challenging. For other people working with kids and families, again, anything that we can do to help get information out about services. There was a lot of interest in Help Me Connect and thinking inclusively about what kinds of services and supports are included in that and how we promote access to that. And then just continuing to build that capacity within those other child serving systems to do screening and awareness building, and to be able to connect people to services that are kind of higher on that triangle when needed. And then finally, a number of things came up that I thought were really interesting about this broader system. How we think about collaboratives, how we think about planning for this work at the state level. Several people said, for example, well, I represent this planning around children's mental health, and we don't really talk about little kids, or we're doing this planning around early childhood education, and we don't really talk about mental health. And so thinking about where are there already planning efforts in place, and is there a way to bring in a little bit more focus on infant and early childhood mental health? And then there's a lot of interest in things like social marketing campaigns and things that are really public facing to help people better understand infant and early childhood mental health. I think that awareness and understanding of that has been increasing, but there's still people out there who don't really understand what does that mean? What does it look like? Can a 6-month-old be depressed? I mean, we have sort of these images of what mental health looks like, and it can be difficult to layer that onto what we know about little kids. And we need to help people understand that better of what well-being and mental health look like when we're talking about youngest kids and how to support them. So I know that's a lot of information. Again, you've got a full report and an executive summary. We have a couple discussion questions that we left in here. But we could talk about that or other questions. As Laura mentioned, Catherine is also on and represents those components of the system that DHS has been supporting, and